children. Thank you.
Good morning. I'm going to go fairly quickly. My name is Donna Snaringer, and I work for the Child Care Resource Center. We're a nonprofit child care services agency, and we provide services in North Los Angeles and San Bernardino County. And I'm going to be focusing on the services we provide related to resource and referral today. Our agency's been part of the Child Care Resource and Referral System in California since 1976, and we're members of the California Child Care Resource and Referral Network. These local programs were created in the 1970s to provide the local infrastructure for families to find care, for providers to go into the business of child care, and for communities to plan care that meets the needs locally. Child Care Resource and Referral Services are known throughout the state by many names. Chair Thurmond, Bananas, you've already mentioned. Also the Contra Costa Child Care Council in your district, and in Chair McCarty's district, Child Action in Sacramento. We're unique to our local communities by design. We're created by the state to reflect and serve our individual communities, but fundamentally we're providing the same core services: consumer education for all families regardless of income, recruitment and training services for child care providers, and in community engagement to build the supply of child care. Funding for these programs has been flat since the mid-1990s. The whole world has changed around us, and we have retained the same level of funding. And during the Great Recession, we saw reductions in the funding we provide. Because of this, we are at estimates at least $15 million behind just keeping up with interest and cost of living. This hinders our ability to serve our local function, and we're being asked to partner at more tables than ever before. In addition, there's been a technology revolution, and resource and referral programs are struggling to keep up with the communication demands of California's families. Technology investments are expensive, and we need the resources to be able to meet families where they are. A strong resource and referral infrastructure at the local level is critical to the statewide system for child care, and it is critical to expand funding to meet the new communication and technology needs. The Child Care and Development Block Grant, which has been mentioned by many of the previous speakers, has new requirements for engagement for R&Rs in consumer education and emergency preparedness. And we're really requesting that you consider ongoing investments, specifically with the first year looking at a $5 million investment and an overtime commitment to make sure your infrastructure locally is ready to deliver the services that you're setting up at the state level. Thank you.
Good morning.
James.
Oops. Good morning. I'm Paula James, Contra Costa Child Care Council, and I also chair the state CACFP Child and Adult Care Food Program Roundtable. I'm going to shift gears a little bit. I'm going to talk to you about child nutrition. And child nutrition really covers everything that we've discussed and we've heard today, which really covers the economics of child care. It covers the health of children in child care. And for more than 30 years, California actually invested in early care nutrition. Sadly, in 2012, that funding was removed, and 90% of the child care sites, both centers and homes that had received state funding, lost that funding. The investment was small, but it was consequential, and it provided support to the USDA Child and Adult Care Food Program. And for those of you that probably are not as conversant with CACFP, that's a program that the USDA provides that's available to child care that ensures that children in child care are getting milk, they're getting fruits and vegetables, they're getting whole grains. And compare that to children who are not in that setting, which means generally something like Kool-Aid and chips and a sandwich. So the investment that was lost was consequential. There were 5,500 centers. There were 20,000 homes that lost state support for 73 million meals, served primarily to young children from low-resource families. Why it matters. So 27% of the children that we're hearing about today are in low-resource families. They're food insecure. And we know that anywhere from 10 to 25%, depending on the zip code you live in, means that you're at risk, if you're a young child, you're at risk of overweight or obesity. Research has linked enrollment in child and adult care food program to better nutrition and better overall quality of care. California should take advantage of the established child and adult care food program infrastructure to ensure that these reimbursements are supporting nutritious meals. A small nutrition investment in early childhood has the power to support educators and families and children. It really supports the financial stability. It really serves our most disadvantaged young children in child care. It helps child care to stay in business, and it helps support high-quality programs. I just want to take a little quick moment and tell you the story of a child care center in Contra Costa that actually, when they lost their child care, their state reimbursement, had to use their educational resources to be able to support the kind of quality food that they wanted to provide for their kids in care. They also, at Thanksgiving time, would buy up all the turkeys that happened to be on sale at Thanksgiving time, and then they would store it year-round to make sure that they had adequate protein for their kids. Meals served in early childhood programs also serve to support families because it frees up much-needed resources that they would have to allocate to bring food to child care. And certainly the ultimate goal is that healthy foods in the stomachs of young children means a healthy start to a healthy life. Investing in early childhood nutrition is an equitable approach to strengthening the state's existing investment in K through 12. K through 12 has deservedly received a state-funded reimbursement for meals served, and providing equivalent funding to early childhood programs ensures that young children enter school with healthy eating habits and makes the most of the nutritious meals that the state supports in the K through 12 settings. Supplementing the Child and Adult Care Food Program makes it more appealing and feasible for early childhood programs to participate in this federally funded program. A relatively small state contribution can incentivize participation and draw federal dollars into local economies that would otherwise be left on the table. And I will remind you that all those dollars that are reimbursed to providers for meals actually go back into the community. Investing in early childhood nutrition is a preventative health strategy that could decrease future state spending caused by unhealthy diets. I'll cite two studies. The children's
that a little bit.
Can I go fast? Yes.
Yeah,
the Children's Health Watch shows that 62% of the children that participate in the child nutrition programs are less likely to be in poor health, and 64% less likely to be in hospitals or be hospitalized. Finally, the California legislature did prioritize nutrition in early care settings. For example, there was 2084 in 2010 that improved the nutritional quality of beverages. And in 2012, there was another bill that really served to support the nutrition training for child care providers. So 42% of licensed centers in California participate in this program, and 41% of the homes participate in this program. So I think that if we could support some state funding, some additional reinvestment of state funding to those child care sites, that we could increase the participation in this program.
Okay, thank you.
Good morning. I'm Angie Garling, and I'm with the Alameda County Early Care and Education Program, and I'm also representing the statewide California Child Care Coordinators Association. And I just wanted to tell you a few unique things about local planning councils and how we support the local infrastructure. We, first of all, have at some level talked about all of these issues that you have brought up. We support all of the previous proposals or recommendations. And local planning councils, there's one in every county, and the members are jointly appointed by the County Board of Supervisors and the County Superintendent of Schools. So these councils are firmly ensconced within local county government, which is a really unique and helpful position. Finally, we are also required to have our council members be equal numbers parents, providers, community members, and public agency representatives. So there's a real mandated diversity, which is a wonderful group to really have those folks come together where we discuss all those proposals around access, quality, rates. It's a place where people come together. That's what planning councils do. And in the 2011-12 fiscal year, our funding was actually cut in half in the middle of the year. So there were some coordinators who were actually laid off in December because they were no longer able to fund the position for the remainder of the year. What that's done is that it's really negatively impacted our ability to effectively do our jobs, bringing local folks together and doing local capacity building. And I'll give you one example. I was contacted by the governor's office about a month ago regarding a provider, a private provider that is serving the new refugees that are Coptic Christians that have been coming from Egypt and are settling in our county, in Alameda County. And there's a man who's pretty much helping to privately support these very low-income families. So he contacted the governor's office. They contacted me. I was able to go out and help connect them with Head Start and local Title V providers and talk to them about refugee services, et cetera, et cetera. For every one of those providers, there are hundreds and probably thousands across the state that could use that additional kind of support, helping to make connections, do local capacity building, work with them to eventually potentially be their own subsidized preschool provider. So for all of the proposals that you are considering, I ask you to think about how the local capacity building could be. If it's stronger, you could actually really effectively deploy those 10,000 slots, which we really hope that you do, that you can effectively increase those rates. If you have strong local capacity building through resource and referral, local planning councils, you can actually get that done in the local community. We're worried that if you don't have local infrastructure that's strong, all of these proposals may fall flat on their face. Thank you.
Thank you. Okay. No comments from committee members on this, not because not an interest, but this is something we know well about, and it's also on the list for consideration for the May revision. So with that, we're going to proceed with public comment, and we're going to ask a few things. One, line up here. We're going to ask people who did not speak before in any of the prior panels to speak first, and hopefully those who spoke earlier can pass on the opportunity to others. And then secondly, we're going to ask people to speak for 60 seconds or less. And again, we ask that you focus on brevity.
We're still in session.
Okay, proceed.
Okay, good morning. My name is Kevin Aslanian. I'm with the Coalition of California Welfare Rights Organizations. And when the whole Welfare to Work program started in California, there was a needs assessment done, and it was determined that 70% of the folks would need child care. Today, only 30% of the folks participating in Welfare to Work program get child care. The document that I've handed out to you, the first column is sort of the counties. The second column shows how many people are participating in the Welfare to Work program. The third column shows how many people are being sanctioned. The fourth column shows how many of them are getting child care. And finally, the last document, the last thing over here shows, shows the large counties. Some counties are providing child care to 15%, some counties 45%. And we have no idea why there's such a big discrepancy. A lot of people get sanctioned because they do not get supportive services. Thank you.
Thank you.
Good morning. My name is Celia Ayala, and I'm the Executive Director of LA Up. And I want to thank, first of all, for having health, human services, and education together, because it is about the children and the families. I really appreciate that you're taking the time to look at the continuum, because it is a 0 to 5 continuum. And just like we look at the K-12 system, that we look at a 0 to 5 system. I appreciate in particular Mr. Thermo's comment about thinking not what it's been necessarily, only to learn from experience, but to be strategic. And what should we look like 10 years from now? And if we look at access, if we look at rates, and if we look at quality, and in all that is the workforce, we want to make sure that our parents have a choice for a mixed model system as diverse as California. Thank you very much.
Thank you.
Hello, my name is Julie Lowen, and I'm the president and CEO of Children's Paradise. We are a QRAS Tier 5 provider in San Diego County. One of the things I want to point out is that on most of your panels this morning, you did not have high-quality early learning providers. And what happens when high-quality early learning providers don't have a voice is that many times we get a whole lot of things thrown at the legislature that we really don't need. So when you're thinking about all of these various programs, think about this. As a hybrid center right now, I use 4 different software systems to manage all of the different types of funding that are coming my way. I have massive quantities of different types of paperwork. I have my families being offered home visiting services by 3 different organizations. They have caseworkers that are approximately 3 or 4 caseworkers per family member. So they go to their AP caseworker, their family service worker through Head Start, their welfare case manager. So there are so many duplications of services within the system that these families operate that if you would work to listen to early learning providers and consolidate all of that, you could actually save a lot of money for the state. Thank you.
My name is Joel Gordon. I'm the retired Dean of Child Development and Teacher Education. I was at Santa Rosa Junior College, and I'm currently the Public Policy Chair for the Community College Educators. I know that you're working and seeing how you can expand the accessibility and the quality of the child care in the state. The quality of that care is going to depend on that workforce, and that training and education of that workforce falls on us at the community colleges. We have 93 lab schools, 105 child development departments throughout the state. We're the second largest bearer of credit-bearing certificates and degrees. Given that, we provide education to about 9,000 children. We have 7,500 children on our waiting list. We have 8,000 parents trying to complete their education in our program. And these lab schools, which are the center of that training, are in a crisis. We have closed 15 of them in the last year. We're asking for your support in a significant rate increase.
Thank you.
Good afternoon. I think we're almost in the afternoon sphere of the day, and I want to just express my gratitude for the two chairs of this committee and how fortunate we are to have the depth of understanding in what you bring to chairing this committee. My name is Mary Jane McGuire Fong. I teach early childhood education at American River College here in Sacramento at Community College. I want to echo the concerns that my colleague Joel Gordon brought to your attention. There are two documents that have now been put in your hands, one one-page fact sheet that will relay to you the dilemma we face when we are asked to do increasingly more rigorous, high-quality early care and education for California. In the hands of those within the community college system, we are asked to prepare the early childhood workforce. In my final 15 seconds, I want to draw your attention to a report issued earlier this month by the National Academy of Sciences. You can't get a more illustrious body asking us to do the following, and California needs to step up to the plate. Quote unquote, they say we need to strengthen practice-based qualification requirements for teachers of young children birth to 8. That means the teachers working with children need to be well prepared. We need to start funding higher education to support teaching practice labs because they are summarily being closed down within our higher education system. Thank you.
Thank you for this opportunity to speak. My name is Dr. Russ Lehrman. I'm a member of Congregation Beth Am. We're a 1,600 family unit Reform synagogue in Los Altos, that's in Santa Clara County. More than 10% of the membership of this organization, 200 family units, is actively engaged in working on enhancing early childhood education through direct support of local professionals, local preschools, working with legislators and policymakers such as yourself through forums like this, working with other faith-based organizations and nonprofits that are working to increase early childhood education programs. We strongly support maximally increasing the investments for high-quality early childhood education at the level recommended by the Women's Caucus, $600 million. Thanks for your time.
Thank you.
Hello, my name is Christine Bindrup, and I'm from Ukiah, California. I am in support of all of the recommendations being made today. As a highly qualified teacher with a master's in education and a teaching credential, I chose early childhood education. It is my passion. I see the benefit to our communities and, more importantly, to our families and children. I have been a licensed exempt child care provider. I've been a home child care provider. I have also taught in the preschool system. It has taken me over 13 years to get above the poverty level. This year I pay taxes, and I'm proud of that. But it's taken me a while because I'm in this program. I'm in this profession. I'm no longer teaching, however. I am an administrator, and I teach the teachers now. I see hundreds of dedicated teachers with so much passion choose to live within their limited means because they know it is the right thing to do. They know it is the best investment of their time. I worry in the coming days in Ukiah, they will be opening up a Costco. I'm afraid we're going to lose a lot of our staff because they pay better. And I would just like to say again, thank you for this hearing. And this is a smart investment for California, and it's also the right thing to do. Thank you.
Hi, my name is Lisa Wilkin. I'm the Executive Director of Child Development Consortium of Los Angeles. We are a nationally accredited Title V child care center provider in Los Angeles. Our average college-educated teacher earns $11.42 in my program. Many of our teachers are eligible for the subsidies that and the programs that we provide. The salaries and benefits of my classroom staff are 80% of my total operating budget. The pending $1 an hour state minimum wage increase will increase my operating expenses by 9%. And the pending local minimum wage increases in the Los Angeles, is where I am, will force us to potentially close the doors of our programs because we cannot afford to pay them those increasing staffing costs. We really encourage you to consider funding us at the maximum that you possibly can. Thank you very much.
Good afternoon, Nina Boothie, Executive Director of the California Child Development Administrators Association. We're a statewide organization that supports publicly funded child development programs. Thank you for the hearing today. We are incredibly supportive of the Legislative Women's Caucus with their $600 million ask for reinvestment back into early childhood programs. Very, very supportive of that. Equally echoing the comments today, I think the minimum wage increase, both the pending as well as the one that's coming online, is going to affect both parents as well as providers. So we're seeking a rate increase for providers, both for our center-based providers as well as our alternative payment programs. We're also seeking an increase in the income ceilings for the state median income. With the impending minimum wage increase, if you have a two-parent family with one child, if they get 10 cents over the minimum wage, they will be over income by 67 cents. So that is two people working at minimum wage, 10 cents over minimum wage, they'll be over income. So we look very forward to working with the committee, putting towards some proposals in terms of rates as well as state median income. And thank you very much for the hearing today.
I'm Cliff Markison. I'm the Executive Director of Options. We do State Department of Education Title V centers in Los Angeles County. We have staff who make less than $10 an hour. We need an increase simply to meet the minimum wage increase that is already on the books. But the city of Los Angeles is going to increase the minimum wage substantially to $13.25 or $15. The votes are there. And there are 3 votes on the County Board of Supervisors to match that for the county of Los Angeles. Other cities are also increasing. If those increases go into effect without a major increase in the rates for Title V programs, they will shut down our programs because we won't be able to pay the minimum amount that we legally can or will be required to pay because the rates from the state are too low to allow us to pay our teachers those amounts. So we ask you to address this issue seriously and save those spaces for families.
Thank you, Cliff.
All right. There we go. Sorry. My name is Abby Sitar, and I've been working for the San Diego Title V nonprofit EES as a preschool director for 3 years. I have 11 years of experience in early childhood education field. I hold a bachelor's degree and an associate's degree, and also a California teaching credential. I manage a preschool site with 84 preschool students ages 3 to 5, and I have 6 teaching staff underneath me. Instruction is completed through play, exploration, routine, and teaching in early education requires the ability to establish and sustain nurturing, trusting relationships with each individual child in the classroom. The current $36.10 standard reimbursement rate results in unprofessional wages, insufficient staffing, and high levels of turnover. High staff turnover is detrimental to the continuity of quality care and instruction young children need. Each time instruction is interrupted by staff turnover, it is the children who regress and suffer emotional and educational consequences. Now is the time to invest in our children and invest in the future of California. It is time to modernize the standard reimbursement rate and tie it to the current RMR. Thank you for your time.
Thank you, Mr. Chair. It's Tony Rice on behalf of the Los Angeles Area Chamber of Commerce. Appreciate this forum today and all the wonderful dialogue. We just want to go on the record as saying we are strongly supportive of the directions that this body has taken over the past year, building off of it, and offer all of our heartfelt support and anything that we can do. We believe that early childhood education is the next frontier of a silver bullet in tackling, helping out working families, tackling poverty issues, establishing a smarter and better workforce for California for many, many years to come. So thank you again so much. Just want to go on the record.
Good afternoon. Thank you, and thank you for listening to all of the public comment today. My name is Celine Crimston, and I'm the Vice President and COO of Educational Enrichment Systems in San Diego. We run full-day, part-day, and toddler programs in San Diego County. Sadly, we do not serve infants anymore because the rate is too low. We can't afford to do that anymore. I've been in this field since 1986, and in my 29 years of experience, I've watched teachers come and go, and that is mostly because of the low wages that we are paying our staff, and it's directly impacted by that standard reimbursement rate. I've also seen families, as we heard today, give up jobs, not take jobs, take pay cuts to be able to stay in the program. The ceiling right now for a family of two parents making $11.50 an hour, they do not qualify for the program. And if they don't qualify for a state-funded program, that's $22,000 in preschool that they don't have. So I'm asking you to equalize the SRR rate as well as look at that income ceiling. Thank you.
Thank you.
Good afternoon, Chair and committee members. Well, I'm a little tall. My name is Lene Williams. I'm a parent from Los Angeles. I have a 4-year-old daughter who currently attends an at-home-based program for Jones Family Child Care. I'm here to encourage you to continue to invest in high-quality early childhood education because I've seen firsthand the positive impacts it's had on my own daughter's development. Access to quality and affordable childcare is very important to me since I am in school myself. I need something that's flexible and allows me to work around my schedule. Jones Family Childcare is half day, so my child is able to go there during the day while I'm at school and I pick her up. She tells me everything she does throughout the day, and I'm very impressed with everything that she's learning, all of the friends that she's making, and the improvements in her social development. I'm very positive that early childhood education is a strong foundation for her development as well as her future success. And I just want to encourage the programs to continue. And I would like to thank you for your time as well as Early Edge for affording us the opportunity to be here today and share our testimony.
Thank you.
Thank you.
I'm going to speak real fast. Good morning. Or good afternoon. My name is Tara Lafayette, and thanks to Early Edge, I'm here to be able to share my experience with early childhood education. I'm a parent from Lake Elizabeth and have 2 little girls, ages 2 and 5. Kenzie, my 5-year-old, currently attends Matheson Preschool, home-based preschool center. I'm here not only as a parent, but as an educator to urge you to invest in high-quality early education because I have seen what a difference it has made on my child as well as countless students. As a parent of a chatty 5-year-old, I often have the joy of listening to her recount every detail of her day. But when she gets to the part about what she learned in school, she lights up with a sense of pride that only occurs during these conversations. The confidence and love for learning she has acquired this year is remarkable, and it impresses me how quickly the program has established these qualities in my daughter. Being a teacher, I'm obviously thrilled with my daughter's excitement in terms of education. As an educator, we know that A student's attitude about learning has a huge impact on his or her ability to access a quality education. Students who are thrown into a classroom without adequate preparation are being set up for failure, and quite frankly, those are the students who stand out in the classroom and tend to be the ones causing disruption in order to focus off their inabilities. I believe our children should be our top priority, and therefore I urge you to support increasing investments to provide all children access to early quality childhood education programs. Thank you.
Very impressive.
That's my daughter. My name is Janet Anderson, and I want to say good morning to all of you, afternoon, and thank Early Edge for allowing me to be here to speak on this very important subject. She's talking about my granddaughter, and I have seen the same development. She does an amazing job. She has learned about countries and the different foods different people eat, different cultures, the different clothing, all kinds of really impressive things. The other day, Tara was taking her to school, and she said, I love you to the moon. And Tara came back and said, I love you to Pluto. And Kenzie, little 5-year-old, says, Pluto? And her mom explained, Pluto is a planet that's really, really far away. And so Kenzie went to school, and when she got home that day, she told her mom, Pluto is not a planet. It's too small, and it's a dwarf planet. And this is a 5-year-old child that not only is learning, but is learning how to learn. Thank you.
Thank you.
Hi, good afternoon. Good morning. I'm sorry, afternoon. I'm kind of nervous. My name is Jessica Jimenez. I'm a parent from Whittier, California. I have 4 kids, ages 16, 11, 6, and 3. I'm here to support Plaza de la Raza, LA Up. I am here to encourage to invest in high-quality education care because I see what happens and impact on my family as it helps my daughter out emotionally, verbal skills, getting ready for kindergarten. I believe that I believe that our children should be California's top priority. What could be more important than investing in our future? I encourage you to support investing to improve access to high-quality early learning and child care for all children, starting at birth. Thank you to Early Edge for having me come to experience being here. Sorry. Thank you.
Great job.
Hi, my name is Juan Singleton, and I'm here because of Early Edge also. My daughter's name is Jemima. That's her picture that you're about to see. And I'm an LA Up parent. She's about to be 5 years old. And me and my wife got introduced to LA Up by Bright Star Academic School. And we looked all around to try to find education for our daughter, but we couldn't afford it, and we made too much money to get in to it ourselves. And LA Up provided us the funds to be able to, or the way to get our daughter into to preschool. So I just want to say that I agree with everybody else. I urge you to please support early childhood education because it's making a difference in working people's lives and everybody's lives. And as I've heard, it's going to make the difference in California for our future.
Thank you for your testimony. And I'll put her on the screen here so the millions watching across California can see why we're here today, to make sure we invest in the next generation. There you go.
Thank you. And I love your tie.
Okay.